Again, it's Thursday, so we always like to talk about health, and today's topic is going to be hormone replacement therapy. Dr. Kyle Rhodes is in from New Hanover Regional Medical Center. Thank you for doing this.
Thank you for having me.
So a little bit before Ganna was doing that, I had asked you, is there anything specific you want to get in? And the thing that is stuck in my head now, you saying, is that there are a lot of misconceptions and a lot of fear that come along with this type of therapy. In an age of advancement that we see in things, why do you think that is still there?
Well, one of the things that, as it relates to women's health care and hormone replacement therapy, we had a landmark study that's now 15 years old, and the study suggested that hormone replacement therapy would double a woman's risk of getting breast cancer.
Gotcha.
So there have been some reevaluations of that information, and within the last 2 years there have been 2 reviews that have come out and suggested we should reconsider hormone replacement therapy for the things that it's actually approved for: resolution of hot flashes, night sweats, dryness, also preservation of bone, but also as the benefit you derive in cardio protection. So for ladies who undergo menopause roughly around the age 50 and would initiate or try hormone therapy between the age of 50 and 60, there's a clear cardioprotective benefit, bone health, quality of life from resolution of hot flashes and night sweats and the dryness. So it isn't for everyone, but a lot of the fear that is not new, truly the fear about developing breast cancer has been around a long time. However, when you think of first-line prevention and other strategies to provide heart protection, women don't have a lot. A lot of the things that are out there pertain to men.
Yeah.
Statin, aspirin, have not been shown to benefit women. So we're not at a point where we would say this should be first-line preventive therapy for women, but the concept is there. And there are just a lot of benefits that come from it that people are unafraid of, and there's still a lot of fear. One of the nice things about it is there are many new ways to provide hormone replacement therapy, and again, the concept is to simply imitate the ovarian function that a woman was exposed to from age 10 to 50. So there are a lot of new things that are available, and a lot of reassuring information that some of the fears from the past perhaps are not founded.
How would a woman know that this is a therapy that is right for her?
Well, so not everyone has these classic symptoms, but certainly those that do are prompted to at least mention it to their physician and talk about it. And that's the other thing, that there's maybe a slight misperception. You, in that age group, let's just say 45 on the young side to up to 60, okay, you can start and stop and see what is my response at the 3-month mark. Okay. And then if you're very satisfied, you may continue. If you're not, then you discontinue. So
is this a therapy that it is something that, once you get started on and you realize that the benefits are working, is this something that you stay on for the entirety of your life, or is there an end game with this?
So there are various opinions. There are the newest thing is to do 5 years or less, but again, the thought process that this decade from 50 to 60, if you feel as though you benefit from it, that you may receive benefit that entire decade. Beyond that, it's not as clear, and it's not something that we would say, look, you must commit to this the rest of your life. Yeah. There's always an end point. People stop at some point, is in their 60s or wherever, but...
And we always tell folks, because there are always questions after these, don't contact me. You always want to go through your doctor if you have questions about a topic. Doctor, thanks for coming in. We're going back after this.